Hello everyone, it's Dr. Mike. We're back here for tip number 48 in our MET 101 ebook series. Please make sure you go to MET101ebook.com, download your free copy, and tip number 48. Now this one is going to be interesting. I've got a lot of reading here, and this one asks the question, what is a MET or medical exercise training protocol? If you don't mind, it's going to be a little bit of reading here, and please, if you would, make sure you download a copy so you can read this yourself. A medical exercise training protocol is defined as a set of guidelines and procedures to manage the exercise programming and progressions for a medical condition. The protocol provides a standard both medical and exercise professionals can use to assure the delivery of safe and effective exercise management of medical conditions. Every aspect of medicine is based on protocols and/or standards. If MET is to be embraced by medical professionals and healthcare systems, then protocols must be utilized to guide the exercise management of clients and functional outcome measures used to determine the effectiveness of the exercise programs. Protocols will evolve and change over time as MET procedures and techniques are refined and updated. These changes will come from medical exercise professionals in the field working with clients and sharing their techniques and outcomes with other medical exercise specialists around the world. And folks, that's vitally important. I know many of you have come from the fitness industry, and the fitness industry isn't so great at sharing their outcomes or their strategies and their procedures and ideas with other professionals. The reason for that is it's every man or woman for themselves. But in the healthcare industry, we try to share as much as we possibly can. So I'm going to ask you, if you would, if you're a medical exercise specialist, you're through the Medical Exercise Training Institute, if you don't mind, if you know other MESs through METI, please share what you're doing as far as your exercise strategies, your programming, what works well, what hasn't worked well, and your best outcomes as well as your worst outcomes, because it helps all of us move medical exercise training forward. With that said, let me read more. These are the components normally found within an MET protocol. Number one, clinical anatomy and pathology review. Number two, program goals, both short and long term. Number three, MET criteria. Number four, MET assessment procedures. Number five, MET precautions. Number six, MET functional outcome measures. Number seven, MET progression guidelines. And number eight, MET flowcharts. The MET protocol is a step-by-step process to progress the client from the assessment through the exercise program and ultimately concluding with specific outcome parameters to measure the progress of the client. The use of functional outcome measures shifts fitness programming to medical exercise training. Functional outcome measures, folks, are vitally important. These are universally understood by doctors, therapists, chiropractors, all aspects of the healthcare industry, insurance carriers, and even the fitness industry. They are clear and universally understood. So when we communicate in this manner, we truly everyone involved with the client understands if the client is making progress or not. MET uses specific and finite timetables, training guidelines, exercise progressions, and assessment measures to avoid vague and fuzzy delivery of MET services. Folks, that's the one thing we have to avoid, vague and fuzzy delivery of MET services. I don't know, I'm not sure. Folks, that's not acceptable when we talk to doctors, therapists, and chiropractors. That's why we designed the original set of medical exercise training protocols. This allows every medical exercise professional, regardless of their geographic location, to deliver the same uniform standard of MET services that are easily followed by medical exercise professionals worldwide and significantly expanding the utilization of MET internationally. Now, this is the section at the end of this question. Don't be afraid to share MET protocols, flowcharts with medical professionals in your community. If you've gone through our MES program and you've gone through the protocols, you'll know that we have a flowchart at the end of each protocol. Folks, everything that medical providers learn, from nurses to physicians to therapists to chiropractors, we use algorithms and flowcharts to show how we manage patients or manage various conditions. When you put a flowchart in front of a medical professional, they're like, oh yeah, I understand that. And it makes it easier now for them to understand exactly what you're doing. They don't know exercise terminology. They have no idea. but they do know the idea of progression or an algorithm that says if the client has or indicates this or does this, we do that. That now shows them that you have a step-by-step professional process rather than doing this randomly. And please let me finish. This allows them to understand MET and exercise progressions and its uses for client management. The protocols and flowcharts will eliminate most of the questions medical professionals have regarding your ability as a medical exercise professional to deliver safe and effective exercise, making referral relationships that much easier. Now, folks, I cannot tell you how important protocols are. Everything you do in your practice should be protocol based, and then that protocol can be changed like a recipe. You put a little pinch of this in, you add a little dash of that, but you still have a guideline. This prevents things from falling through the cracks. And having protocols that can be adjusted for each individual client works well. And share those protocols with the referral sources that you have, but also at some point start sharing those protocols with other medical exercise professionals so we can perfect them. We can spread them throughout the profession so everyone is doing the same standard, producing the same outcomes, and that will help us now become recognized by the medical community and even insurance carriers. So with that said, please download your free copy of the MET 101 manual at MET101ebook.com, and we'll see you in tip number 49. All the best.